Hello, everyone. My name is Dr. Hamza Shaikh. I'm the co-founder and CMO of Radionome. Before I get started, I would like you guys to think of a few questions I want to pose. Number one is, have you ever had an x-ray before? Number two is, where's that x-ray right now? And number three is, if I ask you to show me that x-ray, can you show it to me? So that's kind of what Radionome is about. It's a digital health tech software platform that is being used to securely share medical imaging in a HIPAA compliant manner. We are currently in our early stages of piloting the product, and we're looking to raise $1 million for marketing and sales. And the product is currently available for everyone to evaluate and look at for free online at radionome.com. So what's the problem? This is something that as physicians, we all are very much aware of. If we have CD drives with us, most of us don't even have CD drives on our laptops or anything like that. But the CD is actually a big problem. This legacy hardware in our hospital systems is giving us a big problem because there are 250 plus millions of images being done every day. 7 million of them have actually been repeated because patients don't have CDs. I know I have a lot of problems with this. My brother, who's a radiation oncologist, he also has a lot of problems with patients bringing in CDs that may or may not work. And then if they do work, I may take it and forget to give it back, and then the patient may need to go somewhere and they can't use it. A good example is actually our mother. She had ovarian cancer. She had imaging done at Cooper Hospital, where I am in Camden, New Jersey. She had to go to Memorial Sloan Kettering in New York urgently. And I had to get those CDs to her quickly. My brother was working halfway in between us, so I actually burned the CD at Cooper, drove it to him, drove it to her to Monroe, who then could go with my father urgently or semi-urgently to Memorial Sloan Kettering. So this is kind of the issue that was kind of hitting us close to home, and we thought this was very important to do. So we developed our team. My brother, my name is Hamza Shaikh. As I said, I'm the co-founder, CMO. I trained at Penn and am currently at MD Anderson at Cooper. Justin Frisbee is currently doing his PhD in health economics at Jefferson. As you can imagine, we're on the East Coast. Vipul Narula, he is a co-founder and chief technology officer. He was the previous head of strategy, innovation, and architecture at TD Bank, and he's established multiple products and businesses for Goldman Sachs. He wanted to come to the health tech world, and we got in touch with him. Untitled Chapter, who's the co-founder, is a radiation oncologist who trained at Fox Chase Cancer Center and now works at New York Cancer and Blood Specialists. And our last co-founder is Rajiv Narula, who's a neurologist and CEO of StatMD USA. So we came together and formed this solution. Easy to use, upload, share, and manage images everywhere. So a patient, a physician, a secretary can drag and drop their CDs into this platform, which is web-based. It'll automatically extract the DICOM data, the CD information, make a folder, and allow you to share it with anyone via email, cell phone, whatever you like. It's secure, HIPAA compliant. Medical images for the patient are saved there forever, and it's an FDA cleared DICOM viewer. What we're using is a serverless technology, which allows us to be less hackable. It allows us also to be less expensive as we grow. It is going to be blockchain powered for auditing purposes. We are working with Rowan University, which is close to us, to work on some AI analytics that we can add to this for interpretation of images that come. We are omni-channel, meaning it could be used anywhere because it's web-based. And we also have a mobile app, which is in its beta phase right now. We're using it at my hospital, where physicians can record videos, take pictures like we do, and be able to share it amongst other colleagues in a HIPAA-compliant manner. And those colleagues can actually go through those videos frame by frame without having to pause and play and do all those other things. And then the video is saved forever, unless if they want to delete it. So what is our goal? It's a very lofty goal, right? We want to be somewhat of a universal repository of medical images. So people can come and say, hey, can you radionome this to us? Yes, we're kind of really looking pretty far ahead of ourselves, but we think that this is possible, especially with the scalability of our platform. So the question comes, what are the competitors, right? So you guys have probably heard of these two. They're the major guys in this field. One of the major issues that they have, or some of them, are that you have to be part of the ecosystem to use them. There are patient and physician portals, but they're not really the way you would see in ours. You do have to pay. Ours is free for patients. They are targeting larger practices and hospitals, and their technology is not like ours. They do not have any image capture or sharing ability that we do. And the great thing is, even with them in the market, 80% of the image market is still available. And this is still in its early phase. There are many, many use cases. I actually mentioned one earlier with our mother, but this can be used by imaging centers to automatically share with their referring physicians and the patients as soon as they leave their CAT scan machine. This could be worked between hospitals, right? If there's a trauma that gets shifted to another hospital, they just open up the images and can see them. They don't have to re-image the patient, whether it's a stroke patient that I deal with or trauma patients that my colleagues deal with. One of the major things these days is telemedicine. So we do have easy integration with telehealth platforms. We are working with some of the bigger hospitals in this area in Philadelphia to use this in tumor boards so that physicians can discuss patients no matter where they are. And one of the other pilots we're currently doing is we're actually uploading images for the patient before they have their respective appointments, because many of them don't have CD players. So what's our roadmap looking like? Right now, our MVP is complete. We've beta tested this on about 200 patients. We're currently working with support groups, imaging centers, and hospitals in the area and testing it amongst them as well. Our plan next year is to integrate into EMR systems, specifically Epic, and then start the sales and marketing of this product. Our business model, we are going to be free. I'm sorry? We are going to be free for patients. It's going to be a subscription for imaging centers, hospitals, and large offices. We do believe the data is going to be important if it's de-identified to use for AI augmentation. And we will be offering in-platform purchases for physicians and patients who may be interested in it. Costs, we think smaller places, smaller imaging centers would be about $1,000 a month. To the bigger hospitals would end up being a little bit more. So far, we've given about $400,000 in this product over the last 3 years. We anticipate getting paying customers in the next year and then growing from there, as you can see. This is our competitors, actually. Their valuation is listed up there, and they got their initial raise at $2 million in their startup round. We don't, we are looking for $1 million more for the marketing and sales aspect of this, and obviously for the integration into Epic and to become blockchain powered. Our exit strategy is to grow this product, but be able to integrate into these kind of companies that already have PAC systems or imaging modalities that can use this. Thank you, everyone. So as just to summarize, we're working to remove the CD from a healthcare. We're piloting at multiple locations throughout the region and looking for partners. So
thanks, Hamza. That's a great presentation. Thank you so much. And before Yuli chimes in, I got a quick question. How does this compare with other cloud PACs like post-DICOM? Isn't blockchain slow, or are you using own? This is a question from George.
So we are not using, so blockchain is obviously not going to be used for anything but the auditing purpose of this. So especially when patients are going to share images with people, or physicians they can easily get into the system and be able to see who accessed the image at what time. So the blockchain is not going to be used for anything else but that. How it compares with other PAC systems, cloud-based PAC system, is that As long as they are also using a serverless technology, they're also going to be pretty seamless like ours. Most of them are not. Most of them are using servers, and large data in servers makes it a little bit more hackable. And especially if the server is on site and there's a lot of flow through it, it could slow down. What we're using is a serverless technology, so we are using multiple servers with images distributed amongst the servers to make it less hackable, but also fast.
There is another question on blockchain. It says, love the data provenance and immutability with the blockchain. What architecture layer? Ethereum? And it goes all above my head, but maybe you can answer these.
So honestly, that's very much above my head too. If Vipul Narulo is here, the Chief Technology Officer, he can explain all this stuff. But let me see. What do I have here? This is the architecture. But
it's
I'm
purely,
sorry.
George I was the one who asked that.
Yeah.
I sit on the IEEE's blockchain healthcare standardization. This is super cool. I would love to present this inside that audience.
Cool. So
Okay.
I will introduce you to Vipul, who is the guy behind all of this architecture. But this is his big picture. He did not mention which blockchain it was.
Another question around blockchain was, blockchain is really used to audit only. And then another question from Deepak was, any thoughts on service to pharma, blockchain and follow-up scans, etc., can be useful in the FDA regulated environment? So people are more interested in blockchain, sounds like, than your imaging.
Yeah, I know that we sometimes shy away from saying blockchain, but yes. So we are looking into insurance companies and researchers who are very much interested in this. We think that we may be able to play a big role in that.
Yuli, you have questions?
Yeah, great. Yeah, thanks for the presentation, Hamza. This is awesome.
Okay.
Now, the first question I have that is from myself is, this is a no-brainer product. How come it hasn't been there for the last 20 years?
That's a great question. I think one of the major issues is the technology wasn't there. Imagine opening up a study, even now, you open up a study and it takes forever to load and you're kind of waiting. I think we are at, now with the Netflix, like, we could watch videos at home. I think as this technology has come and the speed has come, that's why this is able to happen now. And especially now with this serverless technology just became available 3 years ago. So this is how new it is. So that's the reason.
So then a follow-up question, how come, Google Cloud, Microsoft Cloud, any of these clouds, how come they don't have that? They can easily, Dropbox can easily build this, right?
Yes. So Google Cloud is, we are on the Google Cloud and we talked to them multiple times. They are interested in these kind of products and they are looking, and I agree with you. It could be very easy for them to make something like this, and they do have this kind of stuff, and they have connected us with many other companies that are in the PACS realm for in the Google Cloud to see if we can work together to do something in the Google Cloud. So they're not doing it themselves, but they are motivating other companies to do it. So yes, I think that is a good exit strategy for many companies actually. Great.
Thank you. So, the potential is amazing. So what is the main service? You're going to the hospitals, taking the discs and uploading it. Is that the main service you're providing?
The initial main service is going to be us going to the hospital and imaging center and basically removing all their imaging onto our cloud and automating the sharing of images at their place. So for example, right now, if a patient goes to an imaging center or a hospital, after they're done, they get a CD and they leave. And then they show it to their doctor. What we would do is will have all the images on the cloud. So as soon as the image is done, they'll get an email or a text that your images are available, and they could click on it and view their images and share them. The referring provider will also get a text or an email saying that your images that you have asked for this patient are available. And we could do many things, you know, there could be groups that could get this and all that. So that is the initial plan.
Yeah, I will ask you a few questions which are from the audience. Just say yes, no, or one or two words. Okay, I'll just rapid round fire. Does the data get uploaded to EHR integrated with Epic? Yes, no.
No, that will be next year.
How about patient follow through? Is there some machine learning built in?
Not yet.
Not yet. Is there a ML specifically working on treatment physiology steady state analysis?
No.
Any limitations with data storage?
No.
Who pays for that? Is the radiology facility pays or charging physician office?
Radiology facility.
Have you calculated potential cost savings for payers?
Yes, we have. We actually did a little mini QI project at our hospital. We saved about $60,000 for one neurosurgeon per year.
Who owns the data?
The patient and where the study is performed.
Okay. I think, can the images be mined for future AI-enabled interpretation of images?
Definitely, and that's what we will be doing.
What might be the incentive for the providers, hospitals to give all the images to Radionome? Good question.
That's a great question. I think if we offer them these services, that will make it easier for them to share images to patients. The study that we did do, it's not published, is that we were able to save per physician one FTE, one secretary FTE, for the amount of time it takes them to upload images and share and things like that.
Great.
So I think we'll be able to show them that we could save money.
Deepak says you'll have a humongous repository for radionomics, MI/AL applications, lots of downstream potentials. Congrats on the endeavor. My question is, would you share that money with the patients or doctors?
Oh, that's where blockchain comes in too. No. So that's very interesting. I don't talk about this, but this is a great question because that is part of our plan. The images are the patient's images. So if someone has a rare disease and people want those pictures, then they have to pay the patient to take them. I mean, that's what our thought is. And I think blockchain will help in that regard.
I have a lot of rare disease patients as a brain neurologist, as you know, and I'll send them all your way. They're ready to make their, their disk is anyways putting a junk so they can make money out of it.
Yeah.
How about security?
How
about security?
Like Instagram.
How about security?
So that's why you see the lock on Radionome. We made sure we built this to be the most secure we can. That's why it's serverless. That's why we have the blockchain auditability. That's why it's, in this way for that specific reason.
Okay. So thanks so much, Hamza. Now we have
Thank
Dr.
you.
Yuli.